Hello, my name is Dayan Siebra, and today this video is very important for you, and I'm sure that at some point in your life you have already started to twitch your eyelid. Therefore, I urge you to focus your attention at this time. At some point in your life, did you notice that your eye moved on its own? It kept shaking like that without you wanting it to? Can you clarify what exactly is that object? I'm curious. Is this bad luck? Is this joy? Is this passion? Is this the onset of prosperity? Is it some serious neurological disease? If you're interested in this, head to the comments now. Subscribe to Dr. Dayan Siebra and keep up with all our videos. So, let's talk about eyelid fluttering. Ever felt your eyelids twitch without control? Do you know the main causes of eyelid twitching? He's aware? Infection, diabetes. Do you know what they are? Approach, I'll inform you. Tension, pressure, strain, stress, these are the underlying reasons. Anxiety has turned into the curse of modern existence. Likewise, strain is the curse of this era. Stress and anxiety are intertwined in this way. Often, it happens in both eyes, and the person usually blinks feeling puzzled and anxious, not sure about the reason for this event. Many people go to an optometrist, fearing a serious problem, and occasionally it can be critical, since stress may be a sign of a severe ailment. Can someone explain why this occurs? The upper eyelid muscle, which is the place where this eyelid tremor occurs most often. Then it becomes weakened, and the nerve fibers release adrenaline, the hormone for fight or flight response. And those among you who feel overwhelmed tend to be fleeing from something, attempting to triumph in a battle. And this adrenaline is thrown into this eye muscle that does just that. And this is still a warning sign. What warning sign, Dayan? Should you fail to make necessary changes to your way of living, your customary practices, it's possible that you could suffer from a heart attack or a stroke, in addition to other health complications. More severe stress with depression, panic attacks, vertigo, gastritis, cancer. This is just a little sign to say so. Look, you are complex, alter your existence, and confront a collapse. Moreover, the involuntary movement of the eyelid is known as blepharospasm. And people think that this is a problem in the eye, and it is not in the eye. It is a problem with your general life, with your life organization, with your stress level. It is an emotional and life organization problem. How to resolve this? Generally, when you improve your diet, start exercising, remove something from your life that no longer serves you, be it your job, be it your husband, be it your wife, be it 20 extra pounds, you start to change, and this type of blepharospasm or tremor of the eyelid begins to decrease. Anyway, you need to slow down. Should you find yourself running low on patience when I advise to take things more leisurely, if your patience is wearing thin, consider the option of turning off this video, because I am about to repeat it once more. Please take a moment to reduce your speed. It seems like you're going quite quickly, possibly suggesting that you might be experiencing some anxiety. Anxious individuals often lack patience for the slow-paced. Do you relate? There is another form, also called benign essential spasm blepharon, which is this. This one is a little different. It's where the eyelid closes, the eye closes, and you can't see. Of course, it's a temporary thing. You won't go blind. It will cover because you won't see because the eyelid is over your eye. This has nothing to do with stress. This generally has no cause or is a neurological cause, a cause specific to each patient. And this case may need Botox. It may even require surgery. And the one where the eyelid closes and doesn't lift, and you have to do something to make the eyelid lift like Botox? Who happens most often? In women. And this treatment for this type of eyelid loss is done with Botox and is provided by the SUS. I don't know if you can do it, but the SUS is saying it can. Now, the only mistake is that the eyelids show signs of stress. No, it's not just the eyelid. The eye often mirrors numerous signals indicating that your body might be under distress. If your blood pressure is high and rises sharply, you may have a hypertensive crisis that could cause a stroke in the eye called a subconjunctival hemorrhage, indicating bleeding under the conjunctiva. Those people who didn't get hit, who wake up with a dark red spot of blood in their eye, it's usually stress. Of course, you have to brush aside other problems and other issues, but it's usually stress. There are inflammatory diseases resulting from stress as well, which are inflammations of the retina, The retina is the part at the back of the eye. You can't see it. It is there behind the eyeball. And this inflammatory retinopathy that comes from stress is central, serous retinopathy. How can we be certain of this? There is a drop in vision. The person says, I can't see straight anymore, out of the blue, generally associated with a period of stress with high levels of cortisol in your body. So, what I want to tell you is, if you have any changes in your eye, whether it's as simple as an eyelid tremor or whether it's more complicated like a subconjunctival hematoma, that is, a bruise in the eye or with a low vision, go to the ophthalmologist, but don't just go to the ophthalmologist. Also go to a doctor who specializes in your emotions. Go to a general practitioner. Go and have your cortisol levels measured. Go and investigate your hormones. Go to a psychologist. Go to a psychiatrist. Go to a coach. Go to a priest. Remove something from your life that is hurting you. Start eating well. Start losing weight. Start changing your lifestyle. If you notice your eyelid twitching, pause to record your thoughts. Write, I'm experiencing this twitch. It's common in my family. It happens often, especially when I'm stressed. Leave a comment like this video, subscribe to Dr. Dayan Siebra's YouTube, and share it with a stressed friend. Likely they'll say, I get that twitch too, okay? Live healthily, live with passion, and stay alert to the signals your body gives you.